A trainer is working with a dog that has a history of pulling aggressively on the leash. Which leash and collar setup should the trainer choose to ensure the dog's safety and promote effective training? Justify your choice based on the dog's behavior and the principles of positive reinforcement training. Answer: the trainer should consider using a front clip harness or a head halter as they provide the best control and safety for a dog prone to pulling. These tools work by redirecting the dog's movement and encouraging proper walking behavior. Front clip harnesses apply pressure on the dog's chest, discouraging pulling without causing harm. A head halter can gently guide the dog's head, providing additional control. The use of a flat collar or a standard harness may not be as effective for a dog with pulling behavior as they do not provide adequate control or redirection. Shock collars or prong collars are generally discouraged in positive reinforcement-based training because they rely on aversive stimuli which can lead to fear or aggression. The goal should always be to use tools that encourage positive behavior change without relying on punishment. Explain the role of a clicker in a positive reinforcement-based training program. How does its use differ from that of verbal markers, and what are the advantages of using a clicker in terms of timing and clarity of communication with the dog? Answer: a clicker is a mechanical audible tool used to mark desired behaviors in a precise, clear, and consistent manner. The sound of the click is immediate and distinctive, allowing for better timing in reinforcing the behavior. Timing is crucial in dog training, as the reinforcement must immediately follow the behavior for the dog to understand which action is being rewarded. Verbal markers, e.g., yes, can be used similarly, but are more prone to variation in tone or timing depending on the trainer's voice, which may affect the dog's ability to clearly associate the reinforcement with the behavior. The clicker is neutral and does not change in tone, offering clearer communication between trainer and dog. The use of the clicker also allows for shaping behaviors where the trainer can reinforce excessive approximations of a desired behavior. The clicker can help create a faster learning environment due to its clarity and immediate feedback. Discuss the ethical considerations of using shock collars and vibration collars in training. How do the principles of humane training conflict with the use of these tools, and what are some potential negative outcomes associated with their use? Answer: the use of shock collars and vibration collars is controversial and often conflicts with the principles of humane and positive reinforcement-based training. Shock collars deliver an aversive stimulus, electric shock, which can cause fear, anxiety, and aggression in dogs. While proponents argue that they may be effective in stopping undesirable behaviors, the potential for harm, such as creating a fearful or distrustful dog, makes them an unethical choice for many trainers who follow humane practices. Vibration collars, while less severe than shock collars, still provide a form of aversive feedback. While they may be seen as a less harmful option, they are not aligned with the philosophy of using positive reinforcement to encourage desired behaviors. Ethical trainers argue that the focus should be on rewarding desirable behaviors rather than punishing undesirable ones. Negative outcomes associated with shock collars can include increased stress levels, fear-based aggression, and damaged dog-owner relationships. In addition, these tools do not teach the dog what to do. Instead, they simply suppress behavior, which may result in confusion and emotional distress. When using a crate or kennel as part of a behavior modification plan for a dog with separation anxiety, what guidelines should a trainer follow to ensure the dog's welfare and prevent exacerbating anxiety or fear-related behaviors? Answer: a crate or kennel can be a helpful tool for dogs with separation anxiety, but it must be used correctly to ensure it is a positive and safe space. Trainers should follow these guidelines. Introduce the crate gradually. The dog should not be forced into the crate, but rather encouraged to view it as a positive space. This can be done by placing treats, toys, and bedding inside to make the crate inviting. Avoid using the crate as punishment. The crate should not be associated with negative experiences or as a form of punishment, as this will increase the dog's anxiety and resistance to the crate. Ensure adequate mental and physical stimulation. The dog should not be left in the crate for long periods without mental or physical engagement. Gradual desensitization. Trainers should work on slowly increasing the dog's tolerance to being alone in the crate for short periods, rewarding calm behavior and reducing anxiety over time. Crate size and safety. The crate should be large enough for the dog to stand, turn around, and lie down comfortably. It should be safe and secure to avoid any injury or distress. Mr. Thompson is leading a group class with 5 dogs, each with varying levels of aggression and reactivity towards other dogs. During the session, one dog, Max, begins to growl and lunge at another dog. How should Mr. Thompson handle this situation to ensure the safety of the dogs and maintain control of the class? Answer: in this scenario, Mr. Thompson must prioritize the safety of the dogs and the control of the group class. The following steps are recommended. Interrupt the behavior immediately. Mr. Thompson should calmly and quickly intervene to prevent the escalation of Max's aggressive behavior. This could involve redirecting Max's attention using a treat, toy, or verbal cue, e.g., leave it. Remove Max from the group. If the situation continues or Max is too agitated to calm down quickly, he should be safely removed from the group and placed in a separate area where he can calm down. Assess the triggers. Once Max is removed from the group, Mr. Thompson should identify the triggers for his aggression, e.g., proximity to certain dogs, specific movements, etc., and work on desensitization and counter-conditioning techniques to address the underlying issue. Reintroduce dogs carefully. After Max has calmed down, he should be reintroduced to the group gradually and under controlled conditions to ensure the safety and comfort of all dogs involved. At client education, Mr. Thompson should educate clients on managing their dog's behavior in group settings and provide advice on how to prevent aggressive behavior before future classes. What are the key safety protocols trainers must adhere to when using training tools such as leashes, collars, and harnesses in their sessions, especially when working with aggressive or fearful dogs? Answer: trainers must adhere to the following key safety protocols to ensure the welfare of the dogs and themselves when using training tools. Inspect equipment regularly for wear and tear to ensure it is in good condition and free of defects that could cause injury. Use appropriate equipment. Select tools based on the dog's size, behavior, and training needs. For example, using a martingale collar for a dog with a narrow head or a front clip harness for a dog prone to pulling. Avoid excessive force. Tools should be used to guide or redirect behavior, not to apply excessive force. Avoid yanking or jerking the leash, which can cause physical harm to the dog. Ensure comfort. The equipment should not cause discomfort or pain. Collars and harnesses should fit properly to avoid causing chafing or restricting breathing. Supervision. Dogs should never be left unattended with training equipment on, as they may get caught or injured. How should a trainer adjust their approach when handling a group of dogs with mixed temperaments, particularly when some dogs are shy or fearful while others are outgoing and assertive? Answer: when managing a group of dogs with mixed temperaments, the trainer should adjust their approach to ensure that all dogs are comfortable and safe. Key strategies include separate training areas. If the differences in temperament are significant, it may be beneficial to divide the dogs into smaller groups based on their behavior, allowing the shy dogs to build confidence without the pressure of more dominant dogs. Gradual introductions. Introduce dogs to each other slowly and observe their body language to assess comfort levels. Start with non-threatening dogs and gradually introduce more assertive ones as the session progresses. Manage energy levels. Outgoing dogs should be given more active tasks, while shy dogs can be paired with calm, gentle dogs to help reduce stress. Use positive reinforcement. Reinforce calm and confident behaviors for both shy and assertive dogs to promote socialization and reduce anxiety or dominance issues. Monitor interactions. Continuously monitor the dog's behavior to prevent any signs of aggression or fear from escalating. Adjust the environment as needed to maintain a calm atmosphere. What are the most important health and safety considerations when conducting a group training session with dogs, and how can a trainer ensure a safe and productive environment for all participants? Answer: the following health and safety considerations are essential when conducting group training sessions. Vaccinations. Ensure that all dogs attending group classes are up to date on vaccinations to prevent the spread of contagious diseases such as kennel cough. Health assessment. Check for any signs of illness, injury, or discomfort in the dog before the session begins. Dogs with visible signs of health problems should not participate in class until cleared by a veterinarian. Safe environment. The training area should be free of hazards, e.g., sharp objects, toxic plants that could cause injury. The floor should provide good traction to prevent slipping, and the environment should be controlled for weather conditions, e.g., shaded area and hot weather. Adequate supervision. Ensure that all dogs are supervised at all times during the session, especially when off leash. Trainers should be vigilant and ready to intervene if necessary to prevent accidents or conflicts. Emergency preparedness. Trainers should be prepared for medical emergencies by having a first aid kit available and knowing the location of the nearest veterinary clinic. How can a trainer manage distractions in a group class, particularly when some dogs become overly fixated on other dogs, sounds, or people in the environment? Answer: to manage distractions effectively, trainers should control the environment, minimize external distractions by choosing a quiet, controlled space for the session, avoid areas with heavy foot traffic, loud noises, or other animals. Focus exercises. Begin the session with focus building exercises such as eye contact, targeting, or sit-stay commands to help the dogs concentrate on the trainer. Gradual exposure. Gradually increase the level of distraction during training, starting with low-level distractions and working up to more challenging scenarios. Reward calm behavior. Use positive reinforcement to reward dogs for staying focused on the trainer and ignoring distractions. Reinforce calm behavior in the presence of distractions, gradually building their ability to ignore them. Use of barriers. For dogs that are particularly reactive to other dogs, consider using a visual barrier, e.g., a temporary divider, to reduce their fixation on other dogs. Explain how a trainer should adjust their training approach when working with different dog breeds or temperaments, particularly when there are significant differences in energy levels and learning styles. Answer: when working with different dog breeds or temperaments, trainers must tailor their approach to suit the individual needs of each dog. This includes breed characteristics. Some breeds like Border Collies or German Shepherds are highly intelligent and may excel with complex tasks, while breeds like Bulldogs or Basset Hounds may require more patience and simpler commands due to their more laid-back nature and energy levels. High-energy breeds such as Terriers may need more frequent breaks and activities to maintain focus during training. Conversely, low-energy breeds may require more motivation through the use of toys, treats, or play to keep them engaged. Temperament considerations. Fearful dogs require a slow, positive approach with plenty of reinforcement for calm behavior. Confident or dominant dogs may benefit from leadership exercises and consistent boundaries to prevent unwanted behaviors. Training style adjustment. Trainers should use a balance of positive reinforcement, shaping, and gentle redirection based on the dog's needs, always considering their unique learning pace and personality traits. Explain the principles of operant conditioning and how reinforcement and punishment can be used to modify a dog's behavior. Provide an example of both a reinforcement and a punishment scenario and describe their potential short and long-term effects on the dog. Answer: operant conditioning involves modifying behavior through consequences based on the principle that behavior is influenced by the consequences that follow. In operant conditioning, reinforcement increases the likelihood of a behavior occurring in the future. It can be positive, adding a stimulus such as a treat, or negative, removing an aversive stimulus such as stopping a loud noise when the dog behaves. Punishment decreases the likelihood of a behavior occurring in the future. It can be positive, adding an aversive stimulus like a shock, or negative, removing a rewarding stimulus such as withholding attention when the dog is misbehaving. For example, positive reinforcement. A dog that sits when asked is given a treat. This strengthens the behavior of sitting on command. Positive punishment. A dog that jumps up on a person is sprayed with water. This can decrease jumping behavior, but may also cause fear or anxiety in the dog if overused. The effects of reinforcement are generally more positive in the long term, fostering trust and reinforcing desirable behaviors. On the other hand, punishment, especially positive punishment, can lead to unwanted side effects like fear or aggression, and if used improperly, it can harm the dog's relationship with the trainer. How does classical conditioning apply to canine behavior modification? Describe a practical example where classical conditioning can help a dog with separation anxiety. Answer: classical conditioning involves pairing a neutral stimulus with an unconditioned stimulus to produce a conditioned response. In the context of canine behavior, the neutral stimulus, e.g., a specific sound or action, is paired with an unconditioned stimulus, e.g., food or affection, that naturally evokes a response, e.g., salivation or relaxation. Over time, the neutral stimulus alone can trigger the conditioned response. For a dog with separation anxiety, an example of classical conditioning might involve pairing the act of the owner leaving the house, the neutral stimulus, with something pleasant like a special treat or toy, the unconditioned stimulus. Over time, the dog learns that the owner's departure is not a signal of distress, but instead associated with a positive experience. This gradual process of desensitization and counter-conditioning can reduce anxiety and fear. Consider a dog showing signs of fearful behavior around strangers. What are the steps involved in conducting a behavioral assessment to understand the causes of this fear? Discuss the role of observing body language and assessing antecedents in your approach. Answer: to assess a dog's fearful behavior around strangers, the following steps are critical. Initial observation. Begin by observing the dog's interactions with strangers from a distance. This allows the dog to remain within its comfort zone while providing insights into its behavior. Body language interpretation. Fearful behavior in dogs often manifests through body language such as lowered posture, tucked tail, dilated pupils, and lip licking. Recognizing these signals helps to identify the severity of the fear and pinpoint triggers. Identifying antecedents. Antecedents are events or circumstances that occur before the fearful behavior. Assess whether specific triggers like sudden movements or certain types of individuals provoke the fear response. Behavior history and case documentation. Gathering information about the dog's past experiences, e.g., traumatic events, lack of socialization, can help understand the root cause of the fear. Client interview. Discuss with the dog's owner about any history of fear-related incidents, changes in environment, or medical issues. This will help to differentiate between situational and underlying emotional causes. Discuss the concept of positive reinforcement schedules in dog training. How do different reinforcement schedules, such as continuous and intermittent reinforcement, affect the behavior of the dog in the long run? Answer: positive reinforcement schedules refer to the frequency and consistency with which reinforcement, e.g., treats, praise, is delivered following a desired behavior. Continuous reinforcement. Reinforcement is provided after every correct behavior. This schedule is effective in establishing new behaviors, as the dog learns that the behavior reliably results in a reward. However, it can lead to quick extinction if reinforcement stops abruptly. Intermittent reinforcement. Reinforcement is provided after some but not all correct behaviors. This can take various forms. Fixed ratio FR. Reinforcement occurs after a set number of correct behaviors, e.g., after every 5 sits. Variable ratio VR. Reinforcement occurs after an unpredictable number of correct behaviors, which tends to result in the most resistant behavior to extinction, e.g., a dog learns to fetch with treats given after random successful attempts. Fixed interval phi. Reinforcement occurs after a fixed period, e.g., after every 5 minutes of calm behavior. Variable interval romance reinforcement occurs after variable amounts of time, promoting consistent behavior over time. Intermittent reinforcement is more resistant to extinction, which is why it's often used for maintaining behaviors over the long term. In contrast, continuous reinforcement is best for initial learning but may not maintain the behavior once rewards are removed. Mr. Davis has a 3-year-old Labrador, Max, who has started exhibiting aggressive behavior towards other dogs during walks. Max is generally calm and obedient at home but becomes increasingly reactive when encountering other dogs in the neighborhood. Mr. Davis is concerned and is seeking advice on how to address this aggression. Based on your understanding of canine behavior, what should Mr. Davis do to assess and address Max's aggressive behavior towards other dogs during walks? Describe a systematic approach to managing this behavior. Answer: Mr. Davis should start with a behavioral assessment to fully understand the situation. Here's the systematic approach to address Max's aggression. Observation and body language interpretation. Mr. Davis should carefully observe Max's body language during walks. Common signs of aggression include growling, stiff posture, raised hackles, and a fixed stare. These signals should be noted as they indicate the level of arousal or fear. Identifying antecedents and triggers. It's important to pinpoint what specifically triggers the aggression, e.g., proximity to other dogs, certain types of dogs, or certain locations. This can help in formulating a behavior modification plan that targets the cause rather than just the symptoms. Behavior history and documentation. Mr. Davis should consider whether there have been past experiences that contributed to Max's fear or aggression, such as a traumatic incident involving another dog. Desensitization and counter-conditioning. If Max is fearful of other dogs, the trainer might employ desensitization, gradually exposing him to other dogs at a distance, ensuring Max remains below his threshold of reactivity. Pairing the presence of other dogs with positive reinforcement, e.g., treats for calm behavior, can help change Max's emotional response to other dogs. Safety protocols. Until Max's behavior improves, it's essential to prioritize safety. Mr. Davis should use a secure harness and leash to maintain control and prevent escalation. He may also choose quieter walking routes to avoid triggers in the early stages of training. By addressing both the emotional and behavioral aspects of aggression, this approach ensures a long-term solution and improved behavior. What is the difference between primary reinforcers and secondary reinforcers in canine training, and how does this distinction impact training strategies? Answer: primary reinforcers are stimuli that naturally reinforce behavior because they satisfy basic biological needs, e.g., food, water, and physical affection. These reinforcers do not require prior learning to be effective. Secondary reinforcers, on the other hand, are stimuli that have acquired reinforcing properties through association with primary reinforcers, e.g., a clicker sound, toys, or a specific word like good. Secondary reinforcers are often used in training to mark desirable behaviors, and their effectiveness can be strengthened when paired with primary reinforcers. Understanding the distinction is important for training strategies. Primary reinforcers are useful for establishing new behaviors, particularly when starting training or when reinforcing basic behaviors. Secondary reinforcers can help maintain behaviors in the long term and are valuable in shaping complex behaviors by creating consistent and predictable reinforcement. Discuss the role of canine cognition and perception in the training process. How do a dog's cognitive abilities, such as problem solving and memory, affect the approach to behavior modification? Answer: canine cognition and perception play a crucial role in behavior modification as they influence how dogs process information and learn from experiences. Problem solving. Dogs with high problem solving abilities are often quick to learn new tasks, especially if the tasks require them to figure out how to obtain a reward. Training should take into account the dog's cognitive level to avoid frustration or confusion. Memory. Dogs have both short-term and long-term memory. Short-term memory allows dogs to remember actions for a brief period, whereas long-term memory helps them recall behaviors learned over time. Memory impacts how well a dog generalizes a learned behavior to different environments. Training must therefore focus on consistency and repetition to ensure that behaviors are ingrained and generalized. Perception. Canine perception involves how dogs interpret sensory information such as sight, sound, and smell. Understanding. A dog's sensory preferences can aid in the design of training methods, such as using high-value rewards that appeal to the dog's strongest sense, e.g., food for dogs with strong olfactory senses. Explain the concept of extinction in operant conditioning and how it can be used to reduce an undesirable behavior in dogs. Discuss potential challenges that trainers might face when implementing extinction protocols. Answer: extinction in operant conditioning refers to the gradual reduction of a behavior when it is no longer reinforced. In the context of dog training, this means stopping the reinforcement of an undesirable behavior, eventually leading to the behavior ceasing because it no longer results in a rewarding consequence. For example, if a dog barks excessively to gain attention and the trainer stops responding to the barking, no verbal attention, eye contact, or treats, the barking should decrease over time as the dog learns that this behavior no longer yields a reward. Challenges in implementing extinction protocols. Extinction burst. Initially, when reinforcement is removed, the behavior might temporarily intensify before it begins to decrease, known as an extinction burst. This can be frustrating for trainers, but it is a natural part of the process. Unintentional reinforcement. In some cases, the trainer may inadvertently reinforce the undesirable behavior, e.g., giving attention when the behavior peaks, making extinction less effective. Describe how social learning influences canine behavior. Provide an example of how a dog might learn a behavior through observation and discuss the implications for training. Answer: social learning occurs when dogs learn behaviors by observing the actions of other dogs or humans. This form of learning relies on imitation and modeling and is particularly evident in puppies who learn social behaviors by watching adult dogs or their littermates. For example, a dog might observe another dog being rewarded for sitting calmly during a greeting. Over time, the observing dog may learn to mimic this behavior to gain similar rewards. This is often seen in multi-dog households where behaviors, both positive and negative, are copied by one dog from another. In training, social learning can be utilized by having well-trained dogs model desirable behaviors which can then be imitated by other dogs. Trainers might also use demonstrations during sessions to encourage dogs to learn by observing human actions. How can understanding internal and external motivation factors in dogs help tailor a more effective training program? Give examples of how different motivations can influence the success of a training approach. Answer: internal motivation factors in dogs include biological needs and drives, such as hunger, thirst, and the desire for physical activity, while external motivation factors involve environmental influences like rewards, praise, or social interaction. For instance, a dog that is highly food motivated might respond well to food-based reinforcement like treats or a favorite chew toy during training sessions. A dog that is more socially motivated might be more responsive to praise or interaction with the owner as a form of reward. Understanding these factors allows trainers to personalize the training approach to the dog's unique motivational profile. If the dog is not motivated by the selected reinforcement, the behavior modification plan will be less effective. The trainer must assess motivation types early in training and adjust strategies accordingly for optimal success. How does early socialization impact a dog's behavior in adulthood, and why is it critical to address during the sensitive developmental stages of a puppy? Discuss how this affects aggression, fear, and sociability in adult dogs. Answer: Early socialization is critical for puppies as it helps them develop proper coping mechanisms, confidence, and emotional stability during the sensitive period, which occurs between 3 to 14 weeks of age. Puppies are highly impressionable, and exposure to a variety of people, animals, environments, and experiences during this time builds a foundation for their behavior in adulthood. Socialization helps reduce the likelihood of fear-based aggression and improve social interactions with other dogs and humans. Research indicates that puppies who do not experience appropriate socialization can develop behavior problems, including increased aggression, fearfulness, and difficulty in adapting to new situations. This is supported by the American Veterinary Society of Animal Behavior (AVSAB) guidelines, which emphasize early socialization as crucial to preventing behavior problems. Dogs not properly socialized during the early developmental stages may experience lifelong emotional challenges, leading to issues such as separation anxiety, fear of novel stimuli, and reactive behavior towards other dogs or people. What unique considerations should be made when training senior dogs, especially regarding their physical and cognitive changes? Discuss strategies for addressing these factors and ensuring effective training. Answer: as dogs age, they undergo physical changes such as reduced mobility, decreased stamina, and potential sensory impairments like hearing or vision loss. Cognitive changes, often referred to as canine cognitive dysfunction syndrome (CEDS), may include disorientation, disrupted sleep patterns, and slower reaction times. These changes impact how a senior dog learns and responds to training. Effective strategies for training senior dogs include adapted training sessions. Keep sessions short to accommodate reduced stamina. Incorporate frequent breaks to prevent fatigue. Positive reinforcement. Use low-impact reward systems such as treats or praise to motivate without overtaxing the dog. Consideration of sensory impairments. For hearing-impaired dogs, hand signals or visual cues are more effective than verbal commands. For dogs with reduced vision, tactile cues can be used. Environmental adjustments. Reduce distractions and provide a calm, quiet environment conducive to learning. Training senior dogs requires patience and empathy, with adjustments made to accommodate their physical and cognitive limitations. How do hormonal changes during adolescence and the senior years impact a dog's behavior, and what strategies can be used to manage behavioral challenges associated with these changes? Answer: hormonal changes during adolescence, 1 to 8 months, and senior years, 7 years, can significantly affect a dog's behavior. During adolescence, rising hormone levels lead to increased territoriality, heightened aggression, and sometimes impulsive behavior. For example, intact male dogs may exhibit more aggressive tendencies due to elevated testosterone levels. In females, unspayed dogs may become more territorial during heat cycles. In senior dogs, hormonal changes, particularly the decline in estrogen and testosterone, can lead to cognitive decline, irritability, and anxiety. These changes may contribute to behavior shifts such as house soiling, increased vocalization, and changes in sleep patterns. Managing these challenges involves behavioral modifications. Focus on redirecting unwanted behaviors with positive reinforcement techniques. Spaying and neutering. For adolescent dogs, spaying or neutering can help reduce hormone-driven behaviors such as marking or aggression. For seniors, hormonal replacement therapy may be recommended in cases of severe cognitive dysfunction. Cognitive stimulation. For senior dogs, providing mental stimulation and a consistent routine can mitigate age-related cognitive decline. Understanding the hormonal influences on behavior is essential for implementing appropriate strategies. Mr. Brown has recently adopted a 4-year-old rescue dog, Max, who exhibits signs of anxiety in unfamiliar environments such as excessive panting, pacing, and barking. Max was found in a shelter and appears to have had little socialization. What steps should Mr. Brown take to help Max overcome his anxiety, and what professional resources should he seek? Answer: Mr. Brown should implement a gradual desensitization and counter-conditioning program to help Max overcome his anxiety. This approach involves slowly exposing Max to stressful situations in a controlled manner while rewarding calm behavior. Key steps include identifying triggers. Mr. Brown should first identify specific stimuli, e.g., certain sounds, locations, or types of people that trigger Max's anxiety. Gradual exposure. Max should be exposed to these triggers at a low intensity, starting with less challenging versions of the stimuli and gradually increasing the difficulty as Max becomes more comfortable. Positive reinforcement. Every time Max shows calm behavior, Mr. Brown should immediately reward him with treats, praise, or play. Relaxation techniques. Teaching Max to relax in stressful situations can also help reduce his anxiety. Mr. Brown should also seek the guidance of a certified dog behavior consultant or a veterinary behaviorist to ensure that the anxiety is managed effectively. If necessary, the veterinarian may recommend medication to support the behavior modification process. How can pain and discomfort influence a dog's behavior, and what signs should trainers look for to differentiate between behavior caused by pain versus behavioral issues? Answer: pain and discomfort can significantly alter a dog's behavior, often leading to aggression, withdrawal, irritability, or reluctance to move. Pain-induced behavior is typically a response to physical issues such as arthritis, hip dysplasia, or an injury. Signs that a dog may be in pain include changes in posture. The dog may adopt a hunched or stiff posture or avoid certain movements, vocalizations, increased whining, growling, or yelping, particularly when touched in specific areas. Behavioral changes. A previously social dog may become withdrawn, or a dog may suddenly display aggression when touched or approached. To differentiate pain-induced behavior from behavior problems, trainers should observe the context of the dog's reactions. For example, if the dog growls when its leg is touched but exhibits no aggression in other contexts, the growling is likely due to pain rather than dominance or fear. Trainers should recommend that the dog be evaluated by a veterinarian to rule out medical conditions. The American Veterinary Medical Association (AVMA) underscores the importance of considering pain as a potential cause of behavioral changes in dogs. How does a dog's diet influence its behavior, and what nutritional factors should be considered when addressing issues such as hyperactivity, aggression, or anxiety? Answer: dietary factors can significantly influence a dog's behavior, as nutrients play a vital role in brain function, hormone regulation, and overall mood stability. Imbalances in a dog's diet can exacerbate behavioral issues such as hyperactivity, aggression, or anxiety. For example, high sugar content in a dog's diet can lead to fluctuations in blood sugar levels, causing hyperactivity or irritability. Inadequate protein or fatty acid intake can affect brain function and mood regulation, potentially leading to anxiety or aggression. Lack of B vitamins and minerals like magnesium and zinc can contribute to nervous system imbalances, making a dog more prone to stress and anxiety. To address behavioral issues, trainers should recommend a balanced, high-quality diet that supports the dog's physical and emotional health. It is also essential to consider potential food allergies or intolerances that could manifest as behavioral changes. The Pet Food Manufacturers Association provides guidelines on the proper formulation of dog food to support behavioral health. What are the potential behavioral side effects of common medications used in veterinary practice, and how can trainers and owners address these effects in their training plans? Answer: medications prescribed to dogs can have various behavioral side effects depending on the drug type and dosage. For example, steroids G. prednisone can cause increased irritability, aggression, and restlessness. Sedatives G. benzodiazepines may result in excessive drowsiness, lethargy, or difficulty concentrating. Antidepressants G. fluoxetine, while used to treat anxiety, can sometimes lead to changes in appetite, restlessness, or in rare cases, aggression. Trainers and owners must be aware of these side effects when working with dogs on medication. It is crucial to work closely with a veterinarian to adjust the dog's medication if negative side effects emerge. Training plans should be adjusted to accommodate the dog's altered energy levels, attention span, and emotional state. The American Veterinary Medical Association (AVMA) provides guidelines for managing pets on medications, including monitoring behavioral changes and collaborating with the prescribing veterinarian to adjust treatment as necessary. What are the signs of age-related cognitive decline in dogs, and how can trainers effectively modify training techniques to accommodate these changes? Answer: cognitive decline in senior dogs, often referred to as canine cognitive dysfunction syndrome (CDS), is similar to dementia in humans and typically manifests in dogs aged 7 or older. Common signs include disorientation. The dog may become confused, wander aimlessly, or fail to recognize familiar people or objects. Sleep disturbances. Senior dogs with CCDS often experience disrupted sleep patterns, staying awake at night and being lethargic during the day. Altered interaction patterns. Dogs with cognitive decline may become more withdrawn or exhibit behavioral changes such as increased vocalization. To accommodate these changes, trainers should use consistent routines. Regularity helps the dog feel more secure and reduces confusion. Simplify training tasks. Break down commands into smaller, easier to understand steps. Encourage mental stimulation. Provide activities like scent games or puzzle toys to keep the dog mentally engaged. How should trainers collaborate with veterinarians when managing a dog with behavioral issues linked to underlying health conditions, and what steps should be taken to ensure an integrated approach? Answer: collaboration between trainers and veterinarians is essential when dealing with behavioral issues that may have a medical basis. Trainers should communicate openly with the dog's veterinarian to discuss symptoms, possible health-related causes, and the dog's behavioral history. The veterinarian can provide diagnostics, including tests to rule out medical conditions such as arthritis, hypothyroidism, or neurological disorders that may contribute to behavior changes. To ensure an integrated approach, exchange information. Trainers should provide detailed observations of the dog's behavior, while veterinarians share any relevant health history or diagnoses. Follow prescribed treatments. Trainers must work in conjunction with the veterinarian's treatment plan, whether it involves medication, pain management, or dietary adjustments. Monitor progress. Both the trainer and veterinarian should track the dog's behavior over time, adjusting strategies based on how the dog responds to treatments. The American Veterinary Behavior Association (AVBA) emphasizes that trainers should always refer to veterinarians for health-related concerns and that an integrated approach results in better outcomes for the dog. Sophia has a 9-year-old dog named Buddy who is showing signs of stiffness, limping, and reluctance to move. Buddy has also become more irritable and less responsive to commands. What should Sophia do to address Buddy's symptoms, and what role does arthritis play in his behavior? Answer: Buddy's symptoms suggest that he may be suffering from canine arthritis, a common condition in senior dogs. Arthritis can lead to joint pain, which makes movement difficult and painful, causing irritability and a reluctance to engage in activities. Sophia should take the following steps. Veterinary consultation. She should have Buddy evaluated by a veterinarian to confirm the diagnosis and discuss treatment options. Pain management. The veterinarian may prescribe anti-inflammatory medications e.g. NSAIDs or joint supplements e.g. glucosamine to alleviate pain and improve mobility. Just training. Sophia should adapt training sessions to accommodate Buddy's limited mobility, focusing on low-impact activities and using positive reinforcement for calm behavior. Environmental modifications. Providing Buddy with supportive bedding, ramps, or non-slip surfaces can reduce stress on his joints. The American Animal Hospital Association (AAHA) recommends early intervention for arthritis to manage pain effectively and improve a senior dog's quality of life.